Hi everyone, I'm Dr. Anitha A Manoj, Obstetrician and Gynaecologist from Sukam Speciality Clinic. What is cervical cancer? Because most of us were worried about this cervical cancer, that is why we are behind the vaccinations also. This is the most common cause of malignancy or cancerous deaths in India in women. That is the first or the leading cause of deaths in India. How to diagnose and how to prevent this cervical cancer. So that is the cancer occurring in the mouth of the uterus. The mouth of the uterus is called cervix. Cancer occurring in the mouth of the uterus is called the cervical cancer. It can be easily diagnosed. That is either by the symptoms or by the screening or the test. Symptoms means a woman will have profuse or abnormal or copious foul smelling white discharge. If the woman has any kind of this, then it is better to meet the doctor and get evaluated. Or abnormal bleeding also, like post-coital bleeding or white discharge associated with the bleeding or irregular bleeding in between the menstruation. So these things also can be, like cancer can be the reason for these things also. An evaluation can be done by either screening methods or by the definitive diagnostic methods. Screening method is a very simple method, that is pap smear. Pap smear, just they'll take a swab. We take a swab from it's a painless thing from the mouth of the uterus and we'll go for screening. So if abnormal cells are found, then we have to go for the definitive diagnosis. Or if we are suspicious about the cervical region, then we have to go for the definitive diagnosis either with a biopsy or with a colposcopy guided biopsy. Definitive diagnosis can be made. Treatment can be surgical or it can be radiotherapy or it can be chemotherapy. If diagnosed early, the early stages can be treated surgically and complete cure is possible. If it is diagnosed little later, primarily it can be treated with the radiotherapy followed by surgery or chemotherapy. But treatment is possible and complete recovery is possible. So better to prevent. How to prevent? Prevention is by every year going for a general health checkup and pap smear screening. If 3 smears are continuously or consecutively negative, then they can go for once in 3 years screening or HPV DNA testing to diagnose the cervical cancer and treat accordingly. And there is HPV vaccination also available, which can be taken from 9 to 45 years of age. So this will prevent the occurrence of cervical cancer. Thank you.